Diana Candelejo from RWJBarnabas Health. Diana is the Corporate Director of Anchor Strategy for the Social Impact and Community Investment Practice at RWJBarnabas Health. With an emphasis on ensuring health equity, the Social Impact Community Investment Practice is rooted in strategic policy change combined with evidence-based and innovative programs that address the social, economic, and environmental conditions that have a significant impact on health outcomes. In her role, Diana leads the system's Anchor mission to hire, buy, invest local. She has spearheaded the formalization of Anchor initiatives at RWJBarnabas's pilot facility, Newark Beth Israel Medical Center, and the South Ward community in Newark. She oversees the Corporate Anchor Roundtable, which is the system's internal accountability mechanism for asset leaders to promote Anchor initiatives across departments. Diana received a Master of Public Administration from the London School of Economics, focusing her studies on economic development, and graduated magna cum laude from Drew University with a bachelor's degree in economics and studio art. So it is my pleasure to introduce Diana. Thank you so much for joining us.
Thank you, Sandra, for that lovely introduction. Good morning, everyone. It's a pleasure to be here today with you all. And I feel like Dean Perry and I connected actually because I do want to start off with a little bit of a story. And from there, I'll talk and segue into our local hiring initiatives at RWJBarnabas Health and what it means to apply an equity lens to that work from an organizational standpoint. So I actually grew up in a town, many of you folks might be familiar, called Newark, right here in New Jersey. And, you know, I am a Newark public school baby. I went through the school system from kindergarten all the way to high school. I should note that I am an immigrant myself. My parents are immigrants from Ecuador. And I was fortunate enough to receive a academic scholarship, the Educational Opportunity Fund scholarship to attend Drew. You know, I, as Sandra mentioned, studied economics, went on to work for a little bit actually as a translator. I'm trilingual in French, Spanish, and English. And so I later pursued my master's degree in international economic development. Upon returning from London to obtain a job right here in my city of Newark, I actually ended up 9 months unemployed. I received rejection upon rejection upon rejection from several corporate employers in the city, and actually, quite frankly, beyond. I also applied in the state of New York. So you can imagine my frustration, you know, having a quantitative background, a social science degree from a prestigious university, and not being able to find work. And so what I started to do is, actually, I even went to like the local job expos and was told, you know, you're overqualified, what are you doing here? I started, actually what I did was I did a bit of a social experiment and I removed my Newark address. And what I found is I started to receive several callbacks, emails, you know, with follow-ups. And so I ended up, you know, going to City Hall to see my mayor and address this issue. Because quite frankly, it showed me that there's a lot of, unfortunately, bias in our employers and how they hire, and really that your zip code or your city where you're applying from can ultimately dictate whether you get an interview or a job, quite frankly. So I ended up being the first hire of an initiative called Newark 2020. I had not applied in all fairness to RWJBarnabas Health. I'm an economist, and so I didn't even think to apply to a healthcare system. So you're probably wondering why in the world would a health system hire an economist? And for one, I will tell you that economists do care about keeping unemployment rates low. But more than that, it really aligned with the system's mission to be an anchor institution. And so what that means is that we as a hospital and our hospital facilities are rooted in place. We're not going anywhere, right? We've, in most cases, been in cities or urban towns and beyond, you know, 100 years or more. Our hospital actually in Newark for over 120 years. And so we are typically like the large employers in a community. We're also large purchasers, and we have a lot of human and economic power. And as an anchor, we adopted this mission to really address health and not just healthcare. And that means that we look at the social determinants of health, because we know that and we recognize that 80% of health outcomes are actually attributed to those socioeconomic, behavioral, and environmental factors. And so where you work, live, and play matter in healthcare and your health outcomes. And so my role really is, again, as Sandra mentioned, to ensure that we are hiring from the communities where we have hospitals, to purchasing from those local vendors, local and diverse vendors in the communities where we have our facilities, and also invest in them. And so the one stat I do I want to make sure I highlight here, because it's quite disturbing to know in New Jersey, the United States has a racial wealth gap issue, but in New Jersey, as we have seen, our issue is much more disastrous. And so the median household wealth for a white family in New Jersey is $352,000. $352,000 in comparison to the median household wealth for a Black family in New Jersey, which is $6,100. And so this is obviously not something that happened overnight. It is something that is a result of many generations of systemic and, quite frankly, racist policies, from homeownership, redlining, to the very nature of the jobs that folks have, the wage gaps, the burden of student loan debt. I mean, it's just, as I said, a systemic issue that contributes to those wealth disparities. So what I want to also say is that our anchor mission does apply an equity lens, right? Equity begs the question, where are those diverse hires? We do have diversity in our workforce, but we need to look deeper. We need to look at, what positions are our diverse hires in? How much are they earning on an hourly rate? We have to look beyond that to look at things like retention. Are we keeping our local hires? It's not just about getting them in the door, but actually providing them also workforce development opportunities. Because what we know is that it's not just about a job, it's about jobs that can provide careers and living wages. And I usually lose human resources at this point when I say a living wage is $25 and up in the state of New Jersey. But this is why training, upskilling, and career ladders are so incredibly important, especially when you make the commitment to hire equitably, because that means that you are running towards those most vulnerable communities, those communities that need the additional supports and services from your institution and the community-based organizations, right? We know that to address these issues of systemic and structural barriers, we can't do it alone. We are a hospital, we're an employer, but we must rely on our, community colleges, our higher education institutions, our community-based organizations to provide those additional supports for our community members. And so in our work, it also requires us to question, where are we advertising? Where are folks actually looking for these job roles? How are we even coming up with a job post, right? Is this something that we've inherited as a standard best practice? Does it mean that it is actually equitable in nature? And so we've been doing a lot of that, self-assessment and reflection in our institution to ensure that our business practices and policies are not exclusive to our local community that we're trying to help. We've also done what I call a zip code analysis, an equity zip code analysis. So it's very easy, again, to throw the word equity and local, and what does that really mean? And so it means that you have to be very intentional about who you're trying to support. And while we appreciate, the federal poverty levels, we do think they are way too low, and it doesn't actually reflect the cost of living in our state. And so we actually leverage the United Way's ALICE threshold income, and ALICE stands for Asset Limited Income Constrained and Employed. So effectively, we're being inclusive of also our struggling working poor populations when we determine vulnerability, but we obviously use an index with other variables such as life expectancy. And as an anchor, we also have to be very place-based and intentional about proximity. So ensuring that, we're hiring folks in our own backyard, especially if we in fact reside in a vulnerable, economically disadvantaged community. So when we also, another way that we apply an equity lens is that we, in our interventions and in our career ladders, actually, we leverage a racial equity assessment. So this is essentially like a rubric where we have different numerical weights for several questions. And it's things like who will be impacted, again, through a racial equity lens, but also thinking of some of the potential adverse impacts of our interventions, because we can't be presumptuous that everything that we design will not have an adverse potentially consequence. And so we're very thoughtful and mindful about ensuring that we are, putting that extra thought in designing and co-designing our interventions with our community partners. And so just to give you an example, and I think I saw Lourdes, my colleague, on the line too, but she's very good at ensuring that our career ladders, again, think about those barriers that some of our vulnerable community members face, like transportation. So I know when she's designing some of these programs, rather than telling folks, you need to travel X, Y, and Z place, and you may not have a car, how do we make it more accessible for folks to perhaps have that training in our facilities, right? And how do we leverage our own employees who are subject matter experts, for example, our pharmacist, to teach these courses and classes to those that are wanting to, upskill and be in these career ladders as pharmacy technicians. It also requires us to be innovative in our trainings. We mentioned community college being a great affordable entry point for many folks, but we've also explored and have, launched our apprenticeships, something that typically is applied in the trades skills area, but in healthcare, not so much. So again, I'm proud to say that Lourdes has spearheaded our 3 career tracks in paramedics, medical lab technicians, and advanced certified nursing assistants. And again, and we know that we have to partner with community partners to address things like childcare. I mean, in the social impact and community investment team, we deal with issues of housing, food insecurity. So it's a very holistic approach to looking at an individual, right? And meeting them where they are, not being presumptuous that everyone that comes through our door, especially when we're trying to be intentional and equitable about those that are most vulnerable, that we have to be mindful that it does come with, additional supports on our end. And with that, I'm trying to think if there's anything else I can jump to, because I know we're close or on time here. So the last thing I will say, honestly, is now we are currently exploring how do we integrate a lot of these equity efforts into performance and evaluation, right, in human resources. And this is still in the design phases, but I think it's something that in order for it to be sustainable, we need to embed this into our processes and practices. This is a long journey. Equity takes a lot of work, but I do know that as equitable as the programs are and the collaborations and the career ladders that we design, we also have to recognize that there's a lot of accountability and responsibility from an employer standpoint to be, conscious about whether we're being exclusive and how do we do a better job about helping those that are most in need. I, in closing, just want to say that, I ask all employers and even community colleges, higher education institutions, we're all anchors. We're all anchor institutions. We've been in our communities for generations. And just think about the impact of your hiring and your purchasing power, and to be very conscious that you're applying, making those hiring decisions, those purchasing decisions in a very conscientious way. And I thank you, and I urge the consortium to definitely leverage RWJBarnabas Health in your endeavors, as we are certainly doing our best efforts to hire locally and provide those career ladder opportunities for our local hires and beyond.
All right. Thank you so much, Diana. We really appreciate your insights and your thoughts on our Pathway and Skills Collaboratives. We really appreciate your time. So we have been working with RWJBarnabas Health, has been an excellent partner with the New Jersey Community College Consortium, and we have been working very closely with RWJBarnabas on 2 very great programs. One is Community College Opportunity Program, where we are using the free community college grant program to enroll Barnabas employees into the associate degrees programs at our community colleges. And we're also working with Barnabas to help provide the classroom training for Barnabas apprenticeship grant program that they have received. So I also want to give a shout out to Lourdes Valdez and John Fagese. They have been excellent to work with so far.